We are going to start with the Mollies Fund and Maggie Biggane, president of the Mollies Fund Melanoma Foundation.
Our foundation is focused on sounding the alarm that skin cancer can be prevented and melanoma, if caught early, can be cured. Besides our healthcare professionals, we have to enlist the support of everyone in the community, federal, state, and local government, members of the business community, educators, and faith-based organizations. In 2014, the Surgeon General of the United States declared skin cancer an epidemic that cost our economy over $8 billion annually. Success will demand a sustained commitment to change behaviors, to educate everyone about sun protection, to teach risk factors, to model appropriate behaviors, to build shade structures, to promote annual body exams by board-certified dermatologists. The opportunity belongs to all of us. We only have to look at the history of smoking in this country to know that we must be more aggressive in our work to eradicate this disease. Our children's future depends on it.
If nurses are knowledgeable about skin cancer, then we can help to prevent skin cancer, and that's my work that I've been doing for a few years now. And this knowledge that these nurses have and then can teach patients can really save lives. They can go home after discharge from Winthrop, because that's the hospital of the day right now. They can go home and say, you know, my nurse taught me to not go outside and garden without a hat on and to stay in the shade. And my nurse taught me it was real important to have a long sleeve shirt on, etc. And they can tell their neighbors and word can spread. This is what I would like to have on the EMR for the patient medical record, electronic medical record. That's what the EMR stands for. That they can ask, have you had skin cancer? Do you have any moles that are changing? Ask these pertinent questions. And then on the end of that, it has the CDC skin protective guidelines that the nurse can teach the patient. It will not take any extra time because the nurse is already examining the skin. So she just needs to say these few sentences as she's examining the skin and then document it on the EMR, and then the patient has had the education and the screening.
Putting sunscreen on, it has to be done properly. And when it's done in the lab and they measure the SPF and everything else, it's a measured amount that's evenly applied in a generous amount. With the aerosol, I think it's easier to miss, to not as evenly spray it. If the wind's blowing and it's blowing all over. So I have some concerns about that. I also have concerns about inhaling it. I say use it, but just use that caution. Make sure they're not, inhaling it. And what I would do is spray it on their back, but then sort of rub it around as well. So you're getting that more even coat. Lycopene is, as far as I understand, a fairly effective natural antioxidant. And a lot of the damage that the UVA does in the skin is by the form of free radicals, particularly with the UVA. The UVB is more a direct impact on the chromosomes themselves, on the DNA structure. And when you consider that, it's really kind of scary that we lay out there and let ourselves get bombarded with it. So in that sense, I could see how any natural antioxidant is probably not a bad idea, including the lycopene. And they've also seen some protective benefits with vitamin C and vitamin E as well. Not enough to, replace your sun protection habits and sun avoidance habits. Use common sense. Do your, I hear all the time, I love to golf, I love to fish, I love to garden. I do too. But try to do those things earlier in the day or later in the afternoon when the sun is not at its zenith.
It's amazing. I probably know about 6 or 7 people who've gone and have been diagnosed and have been cured. So it is curable. And I think I'm here to say that it is because I was cured. But you have to be vigilant and going to see a physician. If you think something looks weird, you just go to the professionals who can diagnose. And I've been to my dermatologist and he said, no, you're good. but thank you for coming in. So that's my message for you tonight. So thanks for coming.